Good afternoon, Dr. Eric here, Fanwood Back Relief Center. Today's topic is the biceps tendon and shoulder pain and how they're interrelated. The biceps muscle is composed of two heads. We have the short head and the long head. The short head is rarely the problem. The tendons of the short head of the bicep attach to the shoulder blade or the scapula. Okay? The long head, that tends to be more interrelated with pain in front of the shoulder and because of the attachment points at the rotator cuff site. Typically, these muscles or tendons in the actual biceps get injured due to overuse or friction between the area. It causes inflammation and affects the way it pulls on the muscle, on the tendon. Usually when there's an overhead movement or a push away from the body or even like a dip, it will irritate that long head of the bicep tendon and affect the way you get pain into the shoulder. Conservative treatments should always be your first line of defense. Chiropractic, physical therapy, acupuncture, massage. In our office, we do thrust maneuvers, manipulation, adjustments to the shoulder joint, to the cervical spine, to the thoracic spine, wherever we find it is restriction or things are not in the right position or place. We also do soft tissue techniques on the shoulder itself, on the tendons of the shoulder, on the biceps, on the scapula, and the spine as well to help release some of those muscles that are being targeted. Also, we advise the patient on different stretches and exercises they can do at home or in the office. Other therapies are very useful, like electrical stimulation and ultrasound. There's a lot, laser. There's a lot of different things out there you can try before you get involved with pharmaceuticals or injections or even surgery, of course. So these are some of the things that we do to treat the biceps tendon. Most of the time the patient gets well, just needs the right amount of treatment and the right amount of time to allow the body to recover and heal. In regards to regaining or going back into working out or their hobbies or whatever that caused the problem initially, we always advise the patient to not stop completely, not rest completely, but maybe cut it down a little bit. Make sure it's comfortable. If there's a little bit of pain, that's okay. But if it becomes very uncomfortable, then of course, always listen to your body. But you want to keep it mobilized and moving. You don't want to refrain from any activity and just hold it across or sling it into your body, because then it delays the healing process. Scar tissue builds up. It gets stiffer over time. So it's always better to move it within a relatively low pain-free or pain-free range of motion. Of course, if the patient's not responding to treatment, we usually co-treat with medical professionals in the area, whether it's pain management, orthopedics, sports doctors, whatever it is we feel like is going to be the best case scenario after we've given it enough time. So if you're suffering with pain into your bicep, into your shoulder, into your neck and your thoracic spine, please give us a call, shoot us a message. We treat it every day in our office and we have a good track record for getting patients well quickly. Any more information on this, you can check us out at fanwoodbackrelief.com. Any questions, you can shoot us a message, give us a call. We're always here and happy to answer your questions. Have a great day. Thanks for watching. Talk to you next time.